Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. In this presentation, we are going to focus upon common medical problems we see in the senior citizens age group, those who are approaching retirement, as we prepare for our retirement, as we prepare for our financial security. The other important department we need to focus is our medical condition. Let me just get you a quick overview of some of the possibilities that we might encounter in our golden years, as they call it. I don't know why they call it golden years, because after listening to this presentation, you may not think those are golden years, but I think we're going to assume those are going to be golden years, or it is up to us to make them as golden years. And I will tell you how some of the things that you can do, take precautions to enjoy a healthy life. By the time we reach age 65, it is just a question of our body going through various phases of what we call as evolution, which leads to common medical problems. And I'm going to be focusing on some of them, the most important ones, and get you some tips on how you recognize them, how you deal with them, and how you live despite those limitations. Of course, the first on top of the list is heart disease. I'm a cardiologist. I have been treating patients for more than 40 years, and of course, heart disease is the number one concern for most people 65 and older. More than 20 to 25% of the people develop heart disease. The heart disease can come in the form of a heart attack, chest pain, irregular heart rhythms, heart failure, or someone who may need a pacemaker, or someone who need a valve replacement. So there are varieties in which a heart condition can present itself. So you need to get a regular checkup. Make sure you get an electrocardiogram. And if you are having any symptoms of a chest pain, you should undergo an evaluation by a cardiologist. While we are talking about heart disease, we should also focus upon some of the risk factors like cholesterol, which needs to be checked every year. And if your cholesterol is high, you need to be on medications. Hypertension is another major risk factor, which is seen in approximately 60 million people in this country. So hypertension is a significant problem as we get older. Hypertension can also add to other complications like kidney problems and the other ones which I'm going to talk about. So focus upon your symptoms. If you're having symptoms, just don't ignore them. Go to your primary doctor, get a referral to your specialist, and make sure you get checked. The second topic I want to talk about is diabetes. Diabetes is very prevalent in the senior citizens group. In certain populations, the incidence of diabetes is almost like 45 to 50%, like the Hispanics, or even in the Indian population, the diabetes incidence is exceedingly high, more than 30-40%. So diabetes is a multi-system disease. It is not only a sugar problem, it is also a vascular problem. What do I mean by a vascular problem? Diabetes really leads to hypertension. It leads to kidney problems. It leads to heart disease. It leads to blockage of arteries in the legs or in the neck. So diabetes is a multi-system problem, and it is important for you to check with your specialist, especially an endocrinologist if you have access to one, and make sure your hemoglobin A1C level is below 7. This can also be greatly helped with things like lowering your carbohydrate intake, increasing your calorie expenditure with regular exercise. And these things will help you to live a productive life despite having these chronic conditions or degenerative diseases, as we call them, as we get into our golden years. Another common problem that we come across is the arthritis. Arthritis is something that can be very mild, where you may take just an occasional pill here and there, or it could be as crippling as you see here with deformities. This is an advanced case of rheumatoid arthritis. There are two major kinds of arthritis, namely rheumatoid arthritis, which is an autoimmune disease. Then we have the degenerative arthritis, which is the degeneration or aging of the joints, which is commonly seen in major joints like hip joints, knee joints, and that's where people end up getting hip replacement, knee replacement. But one of the things I want to caution you about arthritis is the medications that you're taking, because the medications you're taking for arthritis can interact with the medications that you're taking for your heart. For example, if you're taking blood thinners and you add arthritis medications, then you're going to run into an increased risk of bleeding. Along with that, sometimes you may have to take immunosuppressive drugs for arthritis, which can reduce your immune response to infections, and then you may be prone for other complications. So arthritis is another important aspect that we need to keep in mind. As we get older, I shouldn't say that get older, as we get wiser, our cognitive abilities decrease. According to one study, we lose 20% of our cognitive power, our ability to think, analyze, and act by 20% between ages 40 and 70. So it's just a matter of time that we are going to lose our ability to remember things or to calculate serious numbers, things like that. And when your memory becomes impaired, when your ability to think becomes clouded, that's when we need to be concerned about Alzheimer's. Alzheimer's is a very advanced form of like a cognitive impairment where you can't remember where you put the keys, or you can't remember where you are, or when you walk out of the house, you don't remember how to get back to your place. So those are advanced cases of, but as you have memory loss, that is something that we have to understand. And when people are telling us, hey, you're not remembering where you kept your keys, you're not remembering what day it is, and you better understand that you are losing your cognitive power, and you need to see a specialist who can help you with some of these conditions. And of course, again, also on top of the list is cancer. And it is on everybody's mind. It doesn't matter what the age group is. We have read about cancer, because every time something hurts or some bump appears, we are concerned about cancer. And the best thing you want to do is take the first step as soon as possible. See a doctor, get the diagnosis, and see what it is. If it's not cancer, fine. If it's cancer, then we just have to learn more about the cancer and how we can live with that cancer. There are many cancers which have been treated very effectively with medications and surgery and radiation, but there are some cancers which are just pretty virulent, means they just advance very quickly and spread to the rest of the body. When you get a cancer, you need to see a specialist. Another important aspect along the lines of arthritis is the one that involves the bones, and that is osteoporosis, thinning of the bone. Why am I talking about thinning of the bone? Well, thinning of the bone, we may not recognize it. Thinning of the bone can lead to fractures, which can be devastating and debilitating, and sometimes it can be the downhill of our senior life. And that's why it is important to see a family doctor, get bone density done, and if your bones are thin, then there are medications to increase the calcium deposits in your bones so you maintain bone strength. Another important aspect while we are talking about bone is falls. The falls may be related to many things, and some of them can result in significant damage. And falls are important. That's why you have to make sure your floors are clean and you don't wear slippery material. And when you fall, make sure you get checked. because the fall may look like to be a trivial one, but 2 months later you may realize there is a blood clot in the brain because you hit your head when you fell down 2 months ago or 1 month ago. Because of increased frequency of a fall in the elderly age group, you should take all the precautions, and you should also take support of anything that you need, like a walker or a stick. As we get older, a lot of these things are related to lack of activity, which leads to thinning of the bones, which leads to lack of strength, and we are more likely to fall down. As we get older, another important thing we need to keep in mind is pneumonia. Sometimes this pneumonia can be quite devastating. And that's another reason why it becomes important for anybody over the age of 65 to make sure that you take your flu vaccinations and pneumonia vaccinations to prevent any kinds of fulminant or severe pneumonia that can give you a debilitating state. Couple of other things in this picture you can figure, well, this person is on oxygen. All that chronic smoking, which you thought was never going to hurt you, is going to catch up over 20, 30, 40 years. And people will end up getting chronic obstructive pulmonary disease or COPD, where you'll be huffing and puffing. You can hardly walk to the mailbox, and you will be tied to the oxygen canister, and you have to take an inhaler every couple of hours to breathe. And the best way to prevent that is to quit smoking now, before you need this kind of help. As we get older, our circle of people, friends, relationship becomes smaller, 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 and maybe we are the only person left in our circle. And when these things happen, isolation, and that can lead to symptoms of depression. Symptoms of depression could be like mood changes, lack of sleep, anxiety, irritability, and difficulty in concentrating, and lack of interest in life. When you see developing these symptoms, there are ways to help you. And you can find help in this community, you can find help in the society, and also you can find help from your doctors. So just don't ignore them. Make sure that you do pay attention to these symptoms. These symptoms may come on where you may not even recognize that you're having these symptoms before it gets too far. Then you realize, oh my gosh, my whole life is falling apart. What am I going to do? Then you start talking to your neighbors and say, oh man, you going through a major depression. Why don't you go see a doctor? And then you see a doctor, then they get you on the right track. You start getting involved. You start volunteering in a library or in any place. You start mixing with people, start communicating, having more social network. Then you can improve a lot of these symptoms. So that's where it comes in handy. As people get older, I don't understand why they have increased incidence of shingles. That is the herpes virus. And that can be sometimes extremely painful. It runs along the nerve fibers in the chest wall or anywhere else. And there's not a whole lot you can do when you get it. You have to see a doctor because sometimes it can spread to other parts of the body or to other people. Okay, here are some tips on how you can fine-tune your health. First of all, you need to understand your medications. You need to understand your medications and their interactions. I would say take a spreadsheet, put down all the names of the diagnosis, the dosages, the frequencies, and the quantities you get, and what is the reason that medicine you are taking, and what is the major side effect. If you are taking a blood pressure medicine, how many milligrams are you taking? How often are you taking? And how many are you feeling at a time, for 3 months or 1 month, and what is the major side effect? You take a water pill, potassium loss can be a major side effect. If you're taking blood thinner, bleeding is a major side effect. So have a spreadsheet. Make sure you have this spreadsheet mailed to yourself so that when you go to a doctor's office, if you are holding your smartphone, you can pull up your email and forward that to the doctor's office. especially if you're going and seeing a specialist, then you cannot remember all the 12 medications that you are on at that particular moment, especially when you're hurting or you're broken a bone. So you see what I mean? Medications are integral part of your wallet. I'm telling you, more than money, your medication list is important. Put it on a spreadsheet and or make a copy of that and have it on your smartphone, or you can write down all these things. Also write down the name of your pharmacy, phone number, because every time you call a doctor's office, they want to know what pharmacy you're using and what is the phone number. Don't waste your time. Don't make multiple calls. Make sure your phone numbers are listed there. Then you have to have a list of your doctors and the tests that you're supposed to take. So this is going to be your calendar for most of your senior years. When are you supposed to see a primary doctor? When are you supposed to see a heart doctor? When are you supposed to see your colon doctor? When are you supposed to see your arthritis doctor? I mean, if you need those, put them on a calendar. Make sure whatever information that you're supposed to carry with you when you go and see these people, you have everything in a ready. I would say create a folder and keep all your medical reports and tests in that folder in your car. So when you go and see these doctors, say, oh my gosh, I forgot, I don't know. Make sure you have all the information the doctor needs. Otherwise, he can't make a proper diagnosis. Then he has to wait to get those reports, and that's going to delay. That's going to be another second visit, which may be 3 months down the line. You get the point. Okay, I say travel medication kit. This is like a backup medication cabinet for you. And this is more important than your ski gear or I would say a suit for a business meeting. Your travel medication kit must have a replica of what you take at home, so that when you are traveling, all your medications are in one place, and that should be the center of the focus in your suitcase. Because when you're traveling, you don't want to get sick because you ran out of your medications, or you had to call your doctor and you had to go to the pharmacy and try to get a short 1 week supply of medications. That's miserable. That's not going to help you. It's going to ruin your travel or vacation. Okay, here is another tip I want to give. Let's say you have like a Medicare or a supplemental insurance or a prescription plan. Make a photocopy of all your insurance cards, including your driver's license, so that those pictures stay in your wallet. In your smartphone. So if you forget your wallet where you have all your cards, and you come to the doctor's office and the lady says, can I see your driver's license and insurance cards, sir? I'm sorry, I left it at home. I said, that's not going to cut it. We're going to cancel your appointment. You have to come back 3 months later. See, if you have a smartphone, you have all your cards, you can take those pictures and message the picture to the lady or send it by email to the doctor's office. You have to think smart. See, medications. If you're taking medications 2 or 3 times a day, nobody can remember, what you're supposed to take at what time. I would say set an alarm in your smartphone so that every time it will say, it's time to take diabetes medicine. Mr. Johnson, it's time to take your diabetes medicine. Nobody tells you, when it's time to take your coffee. But you have been trained that for 50 years. But when it comes to medications, we are not trained to be taking medications 3 or 4 times a day. So make sure you keep a tab of medications that you are supposed to take, especially if you're taking medications for sugar. And if you take too much medications and you don't eat, you have a problem. If you don't take medications, then you have a different problem. So when you take control of all these things, the most important and one of the most vital things I would say is get active, keep moving. Make it a goal to see if you can cover 10,000 steps per day throughout the day. You see, most of your smartphones have health app. For example, my iPhone has this one. I put it in my pocket all day long when I'm not sitting at the desk. So every time I am moving, it's adding steps. So if I go to the grocery store, I can get 1,000, 2,000 steps. If I go to the mailbox, I can get another 500 steps. Or if I go around the block in the neighborhood, I can get another 2, 3,000 steps. So by the end of the day, you have to have 10,000 steps. If not, get up and go to the grocery store again, because one, it's temperature controlled and it's a protected environment from the weather. So get your extra steps, buy some nice groceries, and then come back. So if you take some of these things to heart and just make them as your routine, that will not only help you to stay healthy, but it will also give you a purpose in life and also take some of the dead time that is eating up your mind and soul. So by redesigning your body, redesigning your mind, redesigning your emotions, you can lead a purposeful senior life. I hope this has been useful to you, and please do subscribe to our channel. We have a number of videos on senior care, and I will see you in the next video.